afternoon, everyone. My name is Stephan Rockwell. I'm a senior director at Palo Alto Networks, and I lead the U.S. healthcare practice from a pre-sales engineering perspective. I'm going to take us through a little journey today, what we call enabling care from anywhere. But I'm going to take a little different twist because I think the audience kind of thirsts for this type of kind of storytelling piece, where I'm going to talk about how the pandemic actually, if there was a silver lining to the pandemic, it really accelerated the digital transformation within our healthcare providers. So I'm going to take us through kind of pre-pandemic, like where we were prior to the pandemic from a hospital system or care provider threat landscape. What changed, during the initial impact from the COVID pandemic. Kind of what did we learn from that, and really from a digital transformation perspective, what was done to react to some of those initial reactions that were made throughout the pandemic period. And then we'll kind of go through, from a care perspective, how did technology enable care from anywhere, meaning that how did care improve, how did patient care improve as a result. So from a traditional sense, from a pre-pandemic, we're talking 20 years or so prior to, this is the way a hospital system looked. And I like to use the reference castle walls, meaning there's a really hard brick and mortar, there's the hospital, there's the data center, everything is inside. Your EMR is inside, all your applications reside within your hospital and data center walls. Your staff and your patients absolutely are receiving care within those same hard walls, meaning that in order to, anything that didn't exist or didn't happen within walls was really by exception, meaning that if an application needed to be leveraged from the outside, it was really something that was really frowned upon from a security controls and security policy. The pace of digital transformation, as you suspect when you look at a hospital walls, this isn't exactly a modern breakneck speed technology revolution. This is really a status quo. Let's focus on the patient and the care delivered within those walls. Regulations were very much set up to, or you can think of chicken and egg, but either the castle was to meet those regulations or the regulations were built to keep the castle in its current state. They kind of became a symbiotic roadblock or hurdle for digital transformation, if you think about it. What's interesting is the patient's expectation of care was, if I am sick or if I need treatment, the expectation is that I go into that hospital and receive it from the clinical staff that is existing inside those patient walls. So it's almost like and as well the staff, or the clinical and non-clinical staff, their expectations of when I go to work, I either work in the data center or within the hospital. So it was really kind of status quo for a very long time. Then we all remember COVID, when the COVID impact hit, particularly very carnal for someone who lives in New York like myself. I mean, it was extremely chaotic and catastrophic. And why is that? Because if you take that same look up on top, you've got your EMR, your apps, your critical patients, and your essential clinical staff within the hospital walls. The data center and the non-essential employees were basically not allowed in the hospitals. They were all sent home or away outside the hospital walls. So the data center was sparsely staffed at all. Really, the hospital walls were really reserved for care clinicians and those who are providing care to patients. Then they tried to leverage, because of the capacity, because of what was going on within the hospital walls, they tried to push all of the non-acute care out to a clinic-based care. Now, the clinic-based care that we know and love today was definitely not set up to support the amount of patients and the amount of testing that was going on within those clinics at the time. There was also an idea to leverage telemedicine. Now, the applications and the telemedicine that we were allowed to access today was not in place, wasn't really not widely used whatsoever. So telemedicine really happened over Zoom, over phone calls, basically, anything that could be done without breaking regulations or really causing the hospital some legal ramifications was leveraged as a result. Really, in general, if you weren't being treated inside the hospital walls, your care was highly impacted by this, by the lack of technology and the lack of means to provide care elsewise. Interestingly enough, the compensation model really wasn't designed to handle this distributed care model, meaning where the acute patients were treated inside the hospital, and really all other non-acute and otherwise were done outside the hospital walls. Now, this really resulted in a chaotic world where compliance was pushed to the limits from a security perspective. Huge remote access type concessions were made to access internal applications, and the capacity, as we well know from a hospital perspective, was pushed extremely beyond its limits. So, what changed? Hospitals well over capacity. I think we talked pretty clearly about that. Care was really restricted inside the hospital walls to the acute COVID-related patients. Staffing models completely shattered. Staffing models did not really weren't adequate and weren't designed for that type of flexibility. Certainly within that short term where COVID impacted those hospital systems. The technology was not set up for that type of flexibility. The security controls were really designed around keeping everything inside the hospital walls, and the application and data within the hospital walls, and not to be accessed generally outside the data center. And billing and compensation, hospitals are really just trying to keep their patients treated, obviously alive when it came to the acute care, but also the non-acute patients still needed treatment. Dialysis was still happening, cancer treatment was still happening. Things that were critical for care other than COVID were still required. So, by the way, hundreds of millions of non-acute patients were sitting outside hospital walls saying, hey, I need my medicine. I have the flu. I have a fever. All of this treatment still needed to happen, and they were deprioritized for all the right reasons. But there was certainly an impact to the care that those patients were being provided. Now, if we look back, we were to do studies against what we did and how we were impacted, and where we might have maybe not had that type of we didn't have to make some of the decisions we had to make. Was the reliance on the physical infrastructure is a real liability, meaning that if a data center is the only place that your data it resides, it's controlled, so you're not able to access it for external access to that data. That's a real liability, meaning you can't flex at any point in your during the pandemic. That was really the impact was greatly felt by the patients and the care that was provided. Interestingly enough, as a result, the patients that were going to the clinics, or going to the non-acute care, or going to see or receiving care via telemedicine, they kind of realize, hey, maybe I don't have to go into the hospital for non-acute care. Maybe I don't need, if I've got a cough or a sniffle, going to the hospital seems like a less optimal route for me to receive care. So in turn, they really changed their expectations. They realized there was a better way to do it, and the hospitals kind of had to meet them where their expectations were. Hospital capacity, meaning if you have X amount of beds, that's the amount of patients that you can treat. Now, that's in a normal non-pandemic era, that's okay you typically don't hit those 100% capacity. So it's less felt, but when you do flex into a pandemic, hopefully we don't see it obviously anytime soon, but if that happens again, you have to be prepared to be able to provide care in a different form, so you don't hit that capacity limits that hospital system. Now, in turn, the hospitals meeting the patient's expectations, meaning that that there's only certain care that really deems the need or deems the requirement to be in the hospital wall. If you need an X-ray, sure, it's most likely in a hospital. If you need to see, 4 different types of doctors in order to receive treatment, sure, the hospital probably makes sense. But if you're going to go and get a physical for some purpose, or you're going to, get your flu shot, probably doesn't need to be happening in a hospital within the hospital walls. So you leave that capacity for those most critical of patients. And from an IT perspective, or really an overall technology perspective, technology was always seen as a threat vector. But in reality, if you turn it inside out and try to support something like what we're seeing here, that technology can be the extreme enabler. Meaning, if as technology is way further advanced or way further along in the digital transformation than most hospital systems are today. Meaning that the hospitals almost need to catch up to that technology and understand that it can enable what they're trying to do from a care perspective, as opposed to threaten it. Legacy networks that existed prior to the pandemic were really hampering their ability to provide greater care for the patients. And we all know that billing and compensation wasn't designed for care outside the hospital walls. That also has made significant progress in evolving and meeting the different types of care that can be provided outside the hospital walls. Now, I want to dig down a little bit into understanding, what was done, what was the reaction to the pandemic. Meaning, we understand what we had done, the evolution that we didn't make. Okay, so what was the evolution we did make as a result? You talk about the journey to the cloud. Journey to the cloud from a care provider perspective isn't the way most, say, commercial and enterprise customers appreciate it as such. Journey to the cloud doesn't mean running to the AWS, Azures, and GCPs of the world per se. And from a care provider's perspective, going to the cloud really means pushing your data and your applications outside the data center walls. Meaning, you're going to leverage third-party applications, ones that maybe exist in a on-premise form factor in your data center. You're going to leverage that same vendor and that same application, but in their SaaS format, meaning it sits in their environments, and they provide that application to you. Some healthcare providers even moved as far into the digital transformation journey to start develop their own cloud apps, ones that might access their EMRs that aren't provided by their EMRs today. Maybe it's an application that that helps them onboard patients better, or bill, do proper billing or accountability throughout their coming into the hospital and providing receiving care and checking back out. And a lot of hospital systems are now either looking or have made the journey where they're actually moving their EMRs into a hosted or a public cloud environment. Meaning they're either buying it from their current EMR vendor in a hosted environment, meaning in their data center or in their cloud environment, or they're actually leveraging their EMR and moving it into their own public cloud environment, AWS, GCP, Azure, for example. Now, when this happened, as a result of the pandemic, as well as a result of the technologies that they've adopted, they've been able to, push the same technologies that they have within the hospital walls outside the hospital walls. They're developing they're able to provide more unique cares within the clinic environments. They're able to push non-acute care out to a care center outside the brick and mortar hospital walls. Some have even gone as far, if not are investigating forms of home care and telemedicine that they can provide that care to their patients in a truly remote fashion. If you think about what a hospital system is trying to do, they're trying to bring patients into a hospital setting or a care setting, provide care, allow them to go home and return and not return to that same care provider, meaning they stay healthy after they leave. The home care and telemedicine allows for that to happen without them having to return to, say, the clinic or the hospital setting. Now, a lot of those hospitals have actually used this same transition to provide, I'll say, a little flexibility for their home workers or their remote workers. They provide hybrid environments so they can retain this talent within their staff to be able to give that flexibility for that employee, so they don't go and move onto a new hospital system down the street. So they're able to retain and prevent attrition within their staff. Our hospital systems have also taken the approach where this is a perfect opportunity for them to address zero trust. Now, when applications sat inside the data center, implementing zero trust in a long established environment is a very difficult thing to do. But when you start moving things out of the cloud, it doesn't have those same rigid walls and those same rigid paths in and out of the networks, where zero trust you're able to implement zero trust in a much easier fashion and build policy around it. Now, because your applications don't sit in the cloud, your applications don't sit in the data center, where you had traditional security controls that were really based on predictable paths in and out of the network. They're now sitting in cloud environments, whether it's SaaS, public cloud, hosted environments. You've got to really change the way you secure this data and these sessions between the user and the application. You need to leverage things such as cloud delivered network security, SASE, if you've heard the term, cloud native security, maybe native cloud toolkits from a security perspective, DLP, CASB from a data loss prevention or a patient data records security perspective, leveraging API to be able to talk to those applications within a cloud environment, and SD-WAN to provide that predictable route and path selection in and out of those cloud environments where your data resides. Now, to really wrap this up, how is technology enabling care from anywhere? Meaning, how is care improved as a result? The care providers and the patients have really kind of met in the middle and said, this is how I want to be treated, and the hospital systems and care providers are kind of meeting them at that point. The hospital itself, the lifeblood of that system, becomes the priority for only critical care, meaning you've kind of freed up space within those hospital systems to provide those critical acute patients within the hospital walls. In turn, you've kind of freed up those beds so you're not really clogging up the capacity or clogging up the system with non-acute patients as a result. It really, from when you leverage these newer technologies too, because they're cloud resident, they don't have those kind of rigid paths in and out of the network. So it really opens up the door to further evolve the care perspective. So really this is really the start of a digital transformation journey. I think if you look at the way the payers and the federal regulations exist, they are able to kind of see that hospital systems have to move forward to this on this digital journey. So they're really looking at changing the way that regulations are written and how insurers are able to compensate those systems as a result. Now, I think I'll pause right there and I'll take a few questions.
Well, thank you so much. That was great. I really enjoyed hearing it, also hearing it in, where I can really focus on it. I think when we participated at HealthIMPACT, we heard a lot about the changes that came out of the pandemic and how technology accelerated, and the technology adoption was accelerated. And, I imagine that with all of the customers that you have, there was varying degrees to which this was impacted. So tell us a little bit about where you saw some of the greatest impact and some of the biggest sort of shifts in attitude, not just during the pandemic, but after as well.
Yeah, that's a great question. I would kind of break it down into two different categories. You had the large, really well-funded hospital systems who were their head was already in that space anyway. We were going to provide care in different forms and really branch out and, move forward from a digital perspective. But interestingly enough, they moved, I would say, a little bit slower because they were already on that path. They weren't really surprised as much as the more rural systems. Because if you think about it, really, a large well-funded hospital system in, say, metro New York City area, they're really just trying to really keep pace or compete with others as far as providing that really splitting the atom, type care. So they were really on that path already. This certainly, don't get me wrong, still accelerated, and they were heavily impacted by the pandemic. But if you look at the rural systems, the large rural systems, not only were they further behind and less or less well funded than those larger hospital systems, they also their patients were more remote, meaning that if they were impacted by the pandemic or were impacted by the lack of care they were able to receive as a result of the pandemic, they really needed a unique way to reach them. They had to reach further into the rural community hospital systems to provide that care, meaning they really had to catch up and go beyond that. From a staffing perspective, some of those community hospital systems don't have the large staffs or large talented staff, so they had to leverage a lot of those SaaS applications or managed services or managed SOCs, all of these technologies that really I won't say spun up, but really became a topic of conversation for those hospital systems.
Right. Yeah. I mean, it really sort of changed, I imagine, from sort of, it would be a nice to have, nice to do, to a must do, right? Were there specific things? I mean, you mentioned, sort of broadly the cloud, cloud, public cloud, some of the SaaS. Are there some specific things that overwhelmingly were adopted that you think will take us, that will sort of change the face of that?
Yeah, 100%. I would say, in a general format, it was getting everything out of, or not being hampered or really constrained by the data center walls. So a lot of these applications, even the EMRs, like I said, pre-pandemic, talking about putting EMR in a public cloud environment was like crazy talk. Like it didn't even warrant a conversation. Now, every one of the cloud service providers has an offering to move your EMR out into their cloud.
Mhm.
That's amazing because they're meeting the need that the hospital systems have. So I think the larger technologies that were adopted, SaaS number one, SaaS-y probably number two, and then really hosted in cloud environments for an EMR perspective. Those are really big kind of paradigm shifts. SD-WAN, when you talk about going out and building clinics on every corner, if you could, you can't do that if you have to wait 6 months for a circuit to be delivered by your circuit provider. SD-WAN allows for that to happen nearly overnight if you can get broadband in overnight. So you could literally run it on 5G if you had the ability to do so.
Right. When it comes to EMR in the cloud, what are some of the main considerations that you think hospitals need to take?
I'll take political aside. That's certainly not my area of expertise, but you have to think about patient records. Obviously, are the lifeblood of a hospital system. Meaning, I've never met an industry other than maybe finance and their actual money. The healthcare system treats their EMR records on par with patient safety. But they won't ever admit that, but that is really what keeps them in business, is having those patient records safe and secure and within their hospital walls. So moving to the cloud, you have to change the way you secure it, the way you inspect it, the way you monitor it, the way you react. It's a very different way to do business, meaning your IT staff does everything they used to do, they don't do anymore. They do it in a completely different way. The rules change, the policies change, the regulations change, the way that you do things change. So moving it to a cloud environment is a very scary move, but it opens the door up for so much more. Think about I'll call them third-party apps, ones that actually talk within your EMR. Maybe they're developed by your EMR itself that really can't happen unless they're in cloud environments. You think about things like community sharing of these EMR systems, that becomes a lot easier. I won't say easier, but a lot more available in a cloud environment when your cloud extends across the entire United States.
Right. And then, I imagine that once that happens, does it change the ability from a staffing perspective for your clinicians to be able to access and stuff from as you had mentioned, kind of the remote worker ability? Is it an enabler there? And what are some of the considerations there?
Yeah, I think most of these technologies, much like care, the way we patients receive care, our eyes were open, and the kind of the hospital system had to meet the expectation of the patient. I think from a technology perspective, the IT department has to meet the staff's expectation as well. We have many hospital systems that they're relying on what the technologies they put in place during the pandemic. Going forward, they intend to keep them in place, meaning hybrid work is something that they want to offer their employees because they don't want to lose them. They want to make sure that those employees you don't have employee burnout. You think about remote radiologists. Most hospital systems leverage remote radiologists, and they literally have worked on the most archaic of technologies in order to do something that really they expect to happen split second. Like the more patient records, the more film that or images that a radiologist can inspect and view really has a direct impact on the net patient revenue that the hospital system brings in. So to be able to provide that more secure, that more optimized way of them doing that level of work is something that the hospital system doesn't want to look back on. So everything is, hey, how can we do this better, faster, more secure? And that's really, a step forward in the way of thinking, where pre-pandemic it was like, hey, castle walls, right? Everything in here is safe, everything out there is bad.
Right. And I guess, and that's, I think when we thought about it before, and I mean, maybe even now, sometimes delivering care anywhere, you think about the patient, right? You think the patient is getting the benefit of this. They're getting the benefit of being able to get care where they need it, when they need it, without going into the hospital if they don't want to. But it also benefits the physicians and clinicians who can do some of the work outside of those four walls as well.
Yeah, if you think about staff, the availability of your staff really affects patient care. You look at the nursing shortage, how that has directly impacted the hospital systems still today. That is, if we can figure out that part of the clinician, how to keep the clinician burnout with technology, that's really nirvana for these systems.
Right. Yeah, no, I love, what you said about technology being the extreme enabler, right? I mean, that's what we've always at HealthIMPACT, that was sort of the beginning of all of this. And somewhere along the way, it became, sort of a burden, a disruption that wasn't positive. And I do think that the silver lining of the pandemic is so much was accelerated and the attitudes towards adoption changed, that we got to a place where the benefits were, seen on both sides. Not to say it's perfect, not to say we're 100% there, but and thinking about some of unintended consequences and things that I think obviously were initially thought about, when hospitals thought about patients, having virtual care. When you think about, and I read an article recently around sort of schools not being filled, right? And so when you think about empty patient beds, that's not what hospitals want. That's not their goal. How, as we look to the future, what are some of the things that you think, will make, hospitals sustainable? Where are we gonna go with this? And what's your, give us a few kind of takeaways of what technology is the great enabler means for the future.
Yeah, I appreciate the question, because it's really kind of it's not natural for a hospital system to think, what are we going to do in the future? Well, that's probably not fair, but it's certainly their primary focus has always been on sustaining the current state of affairs. But yeah, I think hospital systems are looking at different forms of care that can really rely, or I think a hospital system in general is trying to open up all of the avenues for possible care to provide the best care in the best location, ideally, at the optimal time and price, meaning that patients recover best at home. They're more likely to not return to the hospital system, which we all know is a very bad thing for them. I would say home care is really the next frontier from a hospital system, and that's not as simple as how are we going to provide the care. Is it how is that care going to securely communicate back into the care provider, meaning the person that's going to look at these records and is going to make assessments and provide treatment paths forward. How are we going to do billing? How are we going to do all the things that happen within the hospital wall? But how do you do that over a cloud network, the internet, essentially? which is a terrifying, terrifying frontier for most systems, but they know it's got to happen. Whoever figures it out will win. Not that there's a winner and a loser in a hospital system, but that's really, you really want to, most of these hospital systems really want to provide great care, but also really be novel in the way that they do it.
Yeah.
They want to improve care through their efforts and through their technology and their leveraging of it.
Yeah, well, I think that's a great way to sort of close out the conversation. And I think that they do, as you said, there's no winners and losers, but they want the winners to be the patients, and they want, to provide that great care, and technology, is that enabler to allow them to do it. And I think what's exciting is that we've seen it. We're at a time where that's been recognized. So now it's just, how do we, perfect, pivot, change, evolve, and use the right technology at the right time for the right patients, right?
I appreciate that.
Awesome. Well, thank you so much. And I look forward to hearing more from you, and seeing all the great work that you guys do at Palo Alto.
Thank you. I appreciate it. Thank you for the time.
Absolutely.